So today, I could not find a model. So Josh the skeleton is going to be my model. We're going to film some special test videos for the knee, and we're going to start with our lateral pivot shift. So lateral pivot shift is sort of tough. What we're looking for here is confirmation of an ACL injury, and a positive sign is going to be subluxation of the knee and sensations of the knee giving way, like when they're walking. So to perform this test, what I'm going to do is I'm going to grab calcaneus. I'm just going to slightly internally rotate their knee, right? Now while I'm doing this, my other hand will be right here, the knee. On the lateral side, I'm going to be providing a valgus force. So what I'm going to do from here is, while I'm providing that valgus force, I'm going to be bringing them into knee flexion, like so. And what we should see is a subluxation of that patella. And what that tells me is that we have a positive test, and Josh loves to be difficult with these bony landmarks. So positive test is going to be the subluxation of the knee and the symptoms of the knee giving way, like when they're walking, things like that. So from here, what we're going to do now is a McMurray's test. This is a meniscal test that doesn't have great reliability, and it's sort of tough to perform, but it's good for insurance purposes. So another convoluted test. So similar to the lateral pivot shift, we're going to do is I'm going to grab down here. I'm going to position my hand more here. So from here, as I'm going into knee flexion, I'm going to be providing a valgus force, and I'm going to externally rotate. But on my way back down, if my model would relax, please and thank you, I'm going to be doing the opposite, where I'm going to be providing a varus stress. Right? So external rotation for flexion, internal rotation on the way down. It's like a pattern almost. So what we're looking for here is meniscal symptoms such as popping, licking, clicking, grinding, things like that. Odds are you will get a positive test, because this is just a very uncomfortable position to start. So it's not likely that you're going to get a negative test. That's just really uncomfortable, and there's much better tests to perform, such as the O'Donoghue's test. Same position, another meniscal, general meniscus test. But what we're going to do is we're going to bring patient into flexion, and what we're going to do is I'm going to apply a little bit of compression, and I'm just going to internally and externally rotate the tibia like a pepper grinder. Now this is very similar to the Apley's compression, but the patient is supine for this one. And for that, what we're looking for is your meniscus symptoms of popping, clicking, catching, grinding, things like that. Next up, we have our Houston's plica test. So this is looking for plica and or just capsule irritation. So what I'm going to do is I'm going to bring the patient up here. I'm going to push the patella medially with my palm, and I'm going to be palpating the anteromedial superior aspect, looking for a plica, which is kind of a fold. And you can, during your palpations, if they have any, which you might not find any, you can feel flipping. So that's how you would find that plica. But what I'm going to do is I'm going to bring them up into flexion while pushing that patella, and then back down. And a positive sign for this is just going to be irritation with that motion, point tenderness in that spot. Josh has hip problems. It's going to look like this. You're going to be palpating, and what you're going to feel is that plica coming and going, just with that irritation, right? And our last one is our Wilson's test for Wilson's test is for osteochondral defects. So osteochondral defects is just problems with the tibial plateau, with the cartilage and or the bone, causing pain at that joint line area inside the knee. So what you'd have the patient do is you'd have them internally rotate their foot at the tibia, so internally rotate, and then you're going to have them extend their knee until it hurts. Now, the positive test for this is if they externally rotate and they can continue and the pain goes away, that is a positive sign. And what we're looking for that is osteochondral defects. I'd like to thank my model today. Just relaxing.